We all know that healthcare costs are spinning out of control. But when you add in a surgery and a hospital stay after a surgery, those total costs are truly unbelievable. But the question is, if you had a $100,000 or $200,000 hospital bill and you're on Medicare, what would your out-of-pocket expenses be? Well, it depends on the plan you're on, and I think you'll find the answer is shocking. All right, I want to begin by just talking about some of the healthcare costs that people are incurring today for different types of situations. The first one would be the average hospital stay. Average hospital stay right now across the country is right at $3,000 a day. And by the way, this is not intensive care. This is just simply average care. Someone's gone in for something where it's serious enough to be hospitalized, but it's probably not a real life-threatening situation. $3,000 every day. Average stay right now is about 5 days. Okay, second thing would be intensive care. Now, what's interesting about intensive care, the average is truly somewhere between 10 and 25 days, depending upon the severity of the situation. All right, and so right now, cost-wise, it's somewhere between $5,000 to $10,000, and this is primarily because a lot of people in intensive care are on ventilators. So $5,000 to $10,000 a day. They say right now the median for intensive care is just 2 days. And that's primarily because so many people are just going into intensive care after a post-operative type situation. Okay, so again, still very costly. Number three, I want to share with you some cost on just some of the different types of surgeries that seniors are needing right now. But a heart valve, notice not replacement, repair is $75,000. Spine surgery, $75,000. Bypass surgery, $77,000. Carotid artery stent placement here, $77,000. And then this valve replacement, notice here, $85,000 to $135,000, and it just depends on what valve that needs to be replaced. And so the aortic one is the most expensive right now, average $135,000 for that surgery. Liver transplant, a little over $100,000. And then cancer surgery, and you see a wide variety here because it just depends on what type of cancer you have, what's going to have to be removed, really the extent of that surgery. But between $50,000 to $150,000 a day for cancer surgery. Now notice, look at this, a lung removal. So someone just simply has maybe a lobe of the lung removed, that's anywhere from $30,000 to $50,000. But if the full lung is removed, it is $150,000 bill. Okay, so the whole point is when we talked about a bill being $100,000 or $200,000, now you understand that if we're in the hospital beyond just simply average type care, if we're getting into an operation and then intensive care, the follow-up, all those kind of things, and that's how these bills can really become really out of control. Let's keep going. Now I want to talk about if we have these kind of a bill, these types of bills, what are we going to be out of pocket? So when someone goes on Medicare, they have really three options using their Medicare benefits. The first one is just simply to be enrolled, notice, in A and B only. So in fact, to me, as a Medicare advisor, this would be the last option I would even consider, and that is to have no additional insurance beyond Medicare A and B. Surprisingly, though, there's 10% of the population on Medicare that actually this is all they have, nothing beyond original A and B. So I'm going to show you if you had cancer, hospitalization, surgery, those kind of things, what you're looking at financially. The second option would be to enroll in A and B, that A and B original system, but we get a supplemental plan to cover the majority of the risk that we would incur with the gaps that are in original A and B. So we'll talk about that, and then we'll talk about C plans. These is when someone enrolls in Medicare A and B, but they replace it by a private health insurance company's Part C plan. Now, statistically, 10% do this, 40% do that, and about 50% today are doing Advantage plans. So let's look at these high-cost hospital bill scenarios in each of these particular situations. All right, so before I get into that, what I want to do is I want to talk about what services are needed when people go through a serious illness. Okay, first off, obviously most people are going to be in the hospital for some length of time. There'll be outpatient services involved. It could be rehab. It just could be other visits. But outpatient certainly will be a part of it. All the physicians you see, the primary care doctors, the specialists, the anesthesiologists in the operating room, the surgeon involved as well. So a lot of physician services, durable medical equipment. This would be oxygen equipment, nebulizers, wheelchairs, walkers, those types of things that are needed once someone goes home. We have a lot of infusions, injectable meds, chemotherapy, those types of things. Sometimes people then they don't recover from this. They go on hospice for a period of time, or they could just have some ongoing home health care type needs. So my point is these are the kinds of things that we're going to be responsible for. So as we look at these three different options then, what are going to be our out-of-pocket costs? So let's look first off, if someone decides I'm going to get A and B only, I'm not going to have any other insurance, no supplemental supplemental plan, no Advantage plan, no drug plan. And so let's look at what they're going to be responsible for. So notice first off, as we talk about the gaps, the financial liability in A&B only, we have a deductible. Now this deductible is not once a year. It's actually tied to a hospitalization. This year it's $1,632. And so if someone has a serious illness, they're certainly going to be responsible for that. Now these next two gaps do not happen often. These are called extended hospital stays. Notice we're talking month 3, month 4, and month 5. They don't happen very often. They could, but I'm actually going to cross those out for this particular example. Then we get into skilled nursing. Very common for people to go to a skilled nursing facility for intensive rehab after a serious situation. Now what Medicare does is the first 20 days in the skilled nursing facility, Medicare covers everything. They say as long as we've been in the hospital for at least 3 days, that's all they require, 72 hours or longer, they'll cover everything the first 20 days. After that, notice we have 80 more days of rehab. Now the average rehab right now is about 35 days, and the daily copay is $204, so about $3,000 is what someone's going to be out of pocket here. So when we think this through, if I have a serious illness, I had to pay my $1,632. And if I had an average skilled nursing stay of 15 days beyond the 20, that's going to be about $3,000 out of my pocket. All right, so far $1,632. And what happens is Medicare is, of course, going to cover medications for sure, but that actually would be part of my deductible. Okay, so those inpatient meds covered by Medicare A. Now let's talk about Medicare B. This is called the medical side, outpatient side of Medicare. So we have a deductible, $240. Certainly that $240 is going to be met because you're going to see some doctors, specialists, anesthesiologists, so you'll meet that. But here's where the real risk point is, and that would be coinsurance, because Medicare only pays 80% on this B side. Now the B side would be everything, every doctor service, all durable medical equipment, home health care, outpatient meds. So now you're responsible, look at this, for 20%. So if I had a $75,000 surgery, at least half of that's going to go to the B side, which are going to be medications and doctor services. So that'd be $37,500. So I'm going to be on the hook right there alone just for the surgery about $7,500 plus every doctor I saw. I have a lot of patients in my career that have had cancer, and they're probably going to have 20 doctor visits before they ever even go to the hospital for their surgery. And so let's just say each of those doc visit was a $100 doctor visit. They have 20 of them, that's $2,000. They're going to be responsible for 20% of that. So now we're talking a minimum about $400. Plus, anytime they have a CAT scan, an MRI, PET scan, all those scans very much a part of the protocol if we have a serious illness. Most of those are going to be in the neighborhood of $1,000 to $2,000 a piece. So again, we could easily have $10,000 or $20,000 just in scans. So let's just call it $10,000. I'm going to pay 20% of that. So now I'm looking at $2,000 just out of pocket expenses for coinsurance. And then the last item could be excess. I'm not going to even make that a part of this equation other than to mention it because it is a 15% charge. This is when a doctor adds to the bill. Hospitals can't, doctors can. There's a lot of cancer specialists that are going to do this, but again, don't know where you get your care. So I'm just going to cross it out for now, but it potentially could happen. So this is a doctor that adds 15% to the bill, and if you have A and B only and you don't have that covered, that 15% would be out of your pocket. So that's an unknown, so we won't even count that. But as you can see here, we're at $7,900, we're at $9,900, so let's call it $10,000 and 16 here. So I'm just right about $15,000 minimum out of pocket, okay? And so again, I was talking about something that's just a $75,000 bill. So as you can see, that's why I'm not a fan of someone having A and B only. There's just simply too much risk for that. Now let's look if we have A and B only and we get a supplemental plan. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, and so the number one plan right now in America for supplemental plans is a G plan. I'm going to teach about that. By the way, if you decide to get an N plan's still a good plan. You'll take on a little bit more risk with the N plan, but it's still a fine option. But just for the sake of this video, we're just going to talk about the number one plan. 70% of all people today going on supplemental plans get G. The other 30% get N. N's a little lower cost, and you take on a little bit more of a liability. Okay, so again, when we talked about all the gaps in original Medicare A and B, when someone doesn't have a Medigap policy, that Medicare supplemental supplemental plan, they're responsible for all these out-of-pocket expenses. And the most difficult thing with people that have A and B only is that 20% coinsurance that we talked about. It never stops. And think about it, someone goes through chemotherapy, radiation, again, that's that 20% coinsurance that will be out of their pockets. That's why I said probably a minimum $15,000, probably much more than that if they decide to have A and B only. But what can happen if we get a supplemental plan, which means we're just simply taking these gaps that we have and we're transferring the liability of that gap to an insurance company. Now, when we transfer the liability, we have to pay that insurance company a premium to take that liability so that we don't have to pay these gaps. So the number one plan, in fact, the plan that I would go with today would actually be a plan that's called the G plan. And as I teach you about the G plan, I want to be real clear about this. When someone buys a G plan, whether they buy that from ABC Insurance Company or XYZ Insurance Company, the coverage is always the same because Medicare standardizes the supplemental plans, which means Medicare decides what bills are going to be paid and what's not going to be paid. So they set the rules for the bills that are going to be paid. So we would never say, let's go with ABC Supplemental Company versus XYZ Supplemental Company because they pay better. That's not true. They're all going to pay the same bills, the same type of bills, and the same amount of bills. Okay. Now there will be differences among those two companies. Premiums differ, stability of rates differ, the ratings of the company differ, but the coverage is always the same. That's what we mean by standardized Medicare plans. So no matter what company we choose with, if we choose that G plan, what's going to happen? All the bills are covered except, notice, the B deductible. Now, in order to get rid of all those gaps, to have the supplemental company pay those, then we're going to pay them a premium. And we're a nationwide brokerage firm. We write in all 50 states, the District of Columbia, so we're everywhere. And so what I'm getting ready to quote you is just an average rate, folks. Your rate could be higher, it could be a little bit lower. All right, but the point is it gives you kind of a reference point to know where we're going to land when it comes to premium. So this would be a 65-year-old lady turning 65, first going on Medicare. Right now, you can get a supplemental plan G in most markets in the range of about $115 to about $125 a month. Okay, so that's a monthly premium. In some areas, men are a little bit higher, usually about $8 or $10 more on a monthly basis. But let's just keep it simple and let's call it $125 a month. What are we going to spend during that year? So that'd be $250 times 6, so we're looking at $1,500 in premium. Okay, and so what I did by paying that insurance company that $1,500 a year in my premium, I transferred all the liabilities of the 20% coinsurance, excess charge whenever it occurs, and everything on the A side, including all the meds on A and B, all that is now transferred to the insurance company. Medicare pays first. The G plan fills in all the gaps. All right. The only thing I'm responsible for is one gap, which is the B deductible. Now that gap resets every January. This is 2024, so it's $240. Last year it was $226. I don't know what it'll be in 2025, but whatever it is, if you have a G plan, you're going to be responsible to pay that out of pocket, whatever the B deductible is. It's once a year. It's not multiple times, 1 year. So the first $240 of anything coming to the B side, doctor services, outpatient services, labs, scans, durable medical equipment, home health care, all those things, you would pay the first $240. After that, you're done. You can put your checkbook away, your wallet away, your purse away. No more out-of-pocket expenses. So as long as Medicare pays first, that G plan will follow 100% after the B deductible. What did I pay to get rid of all the liability? $1,500. So if I had a $100,000 hospital bill, $200,000 hospital bill, including surgery, intensive care, all that, what am I going to spend? I pay my premium, $1,500, and I pay my B deductible, and then I am done. All right. So that's why I'm saying when it comes to options for large hospital bills, in my opinion, this is our very, very best option. All right. That brings us then to option number 3. Remember, we had A and B only. We had A and B with the supplemental plan. Now we have A and B replaced by a Medicare Advantage plan, also called a C plan. All right. And again, I think right now in the country, there's almost 3,700 Advantage plans, and there's primarily 9 major players in the Advantage market right now throughout the country. There's some regional small carriers, but 9 major players. So when we talk about Advantage plans, let's just talk about some of the differences. Number one, when you get an Advantage plan, what you're doing is you're enrolling into a contract with a private health insurance company that is replacing A and B for for you. Now, keep in mind, you're still paying your B premium. The B premium this year is $174.70 a month, as long as you're single and you make below $103,000 a year. A couple below $206,000 a year, you'd pay $174.70. If you're high income, you pay more. But the point is, whether I have a supplemental plan or I have an Advantage plan or I just have A and B only, I'm going to have to pay my B premium, $174. But that system that we're in now is different. Why? Because once I am enrolled in an Advantage plan, the Medicare A and B system, look, it goes away. No longer is Medicare making the decisions. You're no longer under that Medicare system. You're under a private health insurance company's system. They're now responsible for you, dictating your care and the kind of thing, and the providers and that type of situation. So let's talk about what this looks like financially. Again, when we go with an Advantage plan, typically the Advantage company itself usually has a zero premium to them. I think 2 out of every 3 Advantage plans on the market today has zero premium. Paid Medicare, but you didn't have to pay them anything beyond that, because now you pay as you go for whatever healthcare services that you're going to need. So let's go through a couple of these. So if I have a serious illness, obviously I'm going to the hospital at one time or another, either pre-surgery or post-surgery, I'm going to the hospital. So the Advantage plans will actually select a daily copay. And the average right now is about $350 a day, some a little more, some less, but $350 a day to the hospital. Now, the average stay, as I said earlier, was about five days, so we're looking at, what would that be? Would be $1,750 for that particular stay. So again, this is just going to be average, $1,750 for my hospital stay. Now, you may be in a plan that's 6 days or 7 days, so they usually set a limit, and then once you've reached that limit, you're done paying daily copays. And then if I'm rehospitalized 2 or 3 months down the road, then again, I have to pay that again. So this is each hospitalization, I pay the daily copay. Now, that daily copay covers everything I get that day. Could have been a surgery or not. Could have 3 doctors or 10 doctors, 2 MRIs or no MRIs. It doesn't matter. All my services that day are covered by the daily copay. All right. Now, if I have a specialist copay, this would be if I go to an oncologist, certainly have cancer, or an orthopedic doc, if you had some issue going on with that. But every time you see a specialist, you're going to pay usually about a $50 copay, some a little lower. Normally, the primary care doctors are actually a zero copay, but all your specialists, and you're going to see many of those during any kind of a serious situation, $50 copay. Now, every scan we have is going to be about $250. Again, MRIs, CAT scans, PET scans, each one of those, of course, we'd be out of pocket. And then infusion, injectables. Now, again, let's go over here first. Outpatient surgery, this would be something that was in an ambulatory surgical center. If there had to be some follow-up or that was necessary, $300 copay, covers everything, the doctor, nursing services, the facility fees, as well as the anesthesiologist. And then we get into durable medical equipment. It's 20% coinsurance, skilled nursing facility, about $200 a day, chemotherapy and injectables, normally about a 20% coinsurance. All right, so all I'm trying to teach you is not so much specifically what this is going to be, but the range of what our out-of-pocket expenses are going to be if we go with that Advantage plan. And so again, if I'm on the hospital 3 days, $1,750. Let's say I have durable medical equipment and maybe the bill's $1,000. So then I'm going to be spending about $200 for DME. I probably would see at least 10 specialists prior to anything, especially if it's going to be cancer. So let's just call it 10 of those visits. So I got $500, out of pocket on that. My infusions, injectables, again, that could really vary. If I had $3,000 of those, that would be very low, 20%. Then it would be $600 for that. Chemotherapy could easily be a couple, $1,000 or more. Very, very expensive. And so my whole point is, depending on what service you're going to need, we're going to pay as we go. All right. And so again, nothing here I've shared is ridiculous. We're looking at $1,600, $1,650, $1,850. And so we're talking $1,850 here would put us at $3,600 out of pocket. And again, so that is not going to break the bank by any means. But my whole point is we pay as we go in this particular system. So my supplemental plan, I got rid of the copay liability. I had to meet a deductible and I was done on the G plan. Here, I don't pay a premium, but what's happening, I'm paying anyways. And remember our last slide, as we looked at supplemental plan G with the B deductible, the total out of pocket was what, $1,740. And so what's going to happen here, it's over double that amount of money on my Advantage plan. Sure, I paid no premium, premium, but because I have this pay-as-I-go system, if I have a serious health issue, almost always people will spend more out of pocket on their Advantage plan than they would have on that supplemental plan with their premium. All right, and now I do want to share with you in closing a couple other issues about this system that are really, really important to know. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, so what we said with the A and B only option, what do we have? I think we said probably out of pocket, maybe $15,000. On that supplemental plan G, we were out of pocket $1,740. And then on Advantage plan, we're $3,600. And again, folks, I'm just giving you some average numbers, so please, just trying to get you to have a feel for how you are going to use this system and what it's going to look like financially if indeed you go with A and B only sup or with the Advantage plan. But here's some other issues with Advantage plans that you need to be aware of, especially when you go through really serious healthcare issues. Number one, you're going to have a network of providers because all Advantage plans have an HMO or a PPO. And what this means is we're going to have a narrow range of providers. I don't know of any provider that's going to take all the Advantage plans. I don't think that exists. Some will take the HMO, some will take the PPO, some will take both, but some take none. In fact, we will see from time to time even the whole hospital networks just simply are not going to take an Advantage plan. So if I'm going through a serious health issue, now all of a sudden I have some restrictions when it comes to providers. Why? Because not all of them are going to take the Advantage plans. Now, if I go back to this option, which was that supplemental plan G, right? Now I have Medicare, and I can go to any provider that takes Medicare, just like you could over here if you had A and B only, right? Problem with A and B only is financially it can be devastating. All right, so over here when I've got this C plan, I am going to have a network of providers. You just have to live with that. Number two, also, many times the Advantage plan are going to require that you have a referral. So your primary care doctor, you got to see them first, and they make a referral out to these other specialists that they want you to see within their network. So again, you're not going to have as much control because they're the ones making that doctor selection based upon the referral requirements. Number three, you're also going to have pre-authorizations. Pre-authorization simply means that you need a scan, or you need a hospital stay, you need a surgery, and all those have to be pre-approved by that Advantage company. Okay? That means the doctor makes a recommendation, but the Advantage company has got to agree to that. They've got to agree to that protocol of care. They got to agree to those certain tests and surgery, and if they don't, you're not going to get those services. So now all of a sudden we have services that can be, because of pre-authorizations, delayed or just flat out denied, and that can be very troubling when people are going through serious health issues. Now, as I compare over here, Medicare, A and B, they may put some pre-authorizations on you. It is very rare. But over here, when I have a G plan, again, Medicare may do it, but that insurance company with the G plan cannot put any pre-authorizations. In other words, they cannot add any rules to what Medicare is doing. So if your doctor says you need this and Medicare says we'll cover it, then that supplemental plan is going to follow. Medicare pays, they have to pay. So we never have to worry about an insurance being interfering with the health care that we need. It can happen with C plans, but it cannot happen here with your G plans. It's impossible. All right. And then lastly, important to note, this stands for max out of pockets, MOOPs, reset every January. And I've had this happen before. So earlier we looked at that situation. We gave an example, someone having $3,600 for the cost of their cancer treatment. And so what happened? Well, these numbers reset every January. So in the Advantage system, we pay as we go. We pay co-pays. We pay co-insurance. But eventually, we're going to hit our annual max out of pocket. So right now, those HMOs are going to vary anywhere from about $3,000 to probably $5,000. A PPO is going to have a max out of pocket anywhere from about $4,000 to $7,000. Now, keep in mind, HMO, you can't go out of the network. The PPO, we can go out of network, but it could cost you as much as $10,000 to $12,000 out of your pocket if you want to go to an out-of-network provider. So what happens is through these series of copays, everything is going towards my max out of pocket, but then what's going to happen? Every January, that resets. I had a lady with breast cancer a couple years ago, and she got diagnosed in September, starts getting treatment, chemotherapy, radiation, surgery. She maxed out. Her max out of pocket was literally $6,700 for the year. And within a couple months, she maxed out. treatment's not over. We carry into January, and these reset, and again, she starts paying her copays again until she reached her max out of pocket. So she spent $13,400 within a matter of just a few months because of these resetting of the annual max out of pockets. Okay, so I hope this gives you a good feel. Number one, I hope you never get a serious illness. I hope you don't get a $200,000 hospital bill. I hope that never happens to you. But if it does, you're going to have to decide how do you want your Medicare to work. What do you want covered, and what do you want to be responsible for?